This is a whole different level to anything we've seen before. They're wearing super advanced masks, much nearer to a gas mask than we normally see our hospital staff wearing. Their thick waterproof suits means the doctors and nurses are sealed in. This Naples infectious diseases hospital now only treats COVID-19 patients. Incredibly, so far at least, not a single member of the medical teams has been affected. It can be done, you just have to have the right gear and follow the right protocols. There's a rush on here. The patient inside is deteriorating fast. A nurse prepares an injection outside the treatment room. He never goes inside, communicating through windows to colleagues with the patient. And they never come outside during crisis moments. And this is one. When it's ready, the medicine is passed through a compartment door. Remember, he's not been inside and hasn't touched anyone or anything. But he immediately removes his gloves and scrubs down. This is an absolute constant.
Basically, it's a hospital trust that is dependent upon all of the hospitals working together because the capacity is already pretty much full. And they just accept that if it gets worse, they'll just have to deal with it, but nobody's really sure how. And the numbers are rising, there's no doubt in that. And again, critically, they're getting younger. No doubt about it. Here they're saying it doesn't make any difference if you're young or you're old, you're going to get it.
The lag between the epidemic sweeping through northern Italy and overwhelming the healthcare system there before progressing to the south gave this hospital precious time to prepare. It is the exception in the south. It was already the most advanced hospital. What is really striking here is that the rules of separating infected environments and the clean areas are followed by everyone. But armed security man every connecting corridor in case anyone forgets. We're moved back and the corridors locked down as a new patient is brought in. This happens every time. Preparation is the key to stopping the virus. Preparation and equipment.
Is that speed with which things were organised significant as a factor in controlling the disease?
Yes.
If the hospital's organised, the treatment's better, is that right?
This is the first thing to do in this kind of hospital. It's, Dr. Fiorentino now is organizing these two wards, and it's very, very important to separate the street and so on, to organize how dress and undress, how put a doctor or nurse in the room, how put your mask. It's very important.
And also, you have to have the right equipment.
Yeah.
To do it.
Yeah, we fight for, but however now we are.
This is a sub-intensive care unit. The patients are either recovering or haven't deteriorated yet. But the same separation rules apply. The red and white line cannot be crossed. Clean area nurses and doctors assist infected area staff across the line. They keep the two absolutely separate.
Because in other hospitals, they were together. There was too chaotic.
No,
you have to be separate.
There is a higher number of infection in the doctors, in the nurse.
Yeah, very high.
Yes. In this hospital, nothing.
Across the world, as the pandemic spreads, we're seeing the number of infected and dying jump every day. Health workers are right on the front line, and they're succumbing to the illness every day as well. Perhaps, though, it doesn't have to be inevitable. It isn't here. But they do have the kit. They don't just hope. Stuart Ramsay, Sky News, Naples.